Consequentialism in healthcare ethics. When healthcare professionals make ethical decisions, one of the most influential questions they ask, sometimes consciously, sometimes not, is this: what outcome will this decision produce? Consequentialism is the ethical theory that places that question at the very center of moral reasoning. In healthcare ethics, consequentialism evaluates the morality of actions based on their results. An action is considered ethically right if it produces better overall outcomes than the available alternatives. What matters most is not intention, motive, or rule following, but the real-world effects of a decision on patients, families, healthcare systems, and society. The most familiar form of consequentialism is utilitarianism, which argues that ethical action is the one that maximizes overall well-being or minimizes overall harm. In healthcare, this often translates into decisions aimed at saving the most lives, reducing suffering, improving quality of life, or using limited resources in ways that benefit the greatest number of people. This approach fits naturally into modern healthcare because medicine is outcome-driven. Treatments are evaluated based on effectiveness. Policies are assessed by population health data. Public health decisions are justified by statistical impact rather than individual preference alone. Consequentialist reasoning aligns closely with this evidence-based mindset. Consider triage in emergency medicine. When resources are limited, such as ICU beds, ventilators, or surgical staff, healthcare providers may prioritize patients based on likelihood of survival or potential benefit. From a consequentialist perspective, this is ethically justified because it aims to achieve the best overall outcome with the resources available, even though it may feel uncomfortable on an individual level. Public health ethics also relies heavily on consequentialist reasoning. Vaccination programs, quarantine measures, and screening policies are often defended on the grounds that they reduce overall harm, even if they place burdens on some individuals. The ethical justification lies in preventing widespread suffering, death, or system collapse. In your healthcare ethics framework, this connects directly to the principles of beneficence and non-maleficence. Consequentialism emphasizes acting in ways that promote good outcomes and reduce harm. It asks healthcare professionals to weigh benefits against risks and to consider long-term effects, not just immediate results. However, consequentialism also raises serious ethical tensions, especially in healthcare, where individual patients are not abstract data points, but real people with dignity, rights, and autonomy. One of the most common criticisms of consequentialism is that it can justify morally troubling actions if the outcomes are judged to be sufficiently beneficial. For example, if violating a patient's autonomy would produce better overall results, a strict consequentialist framework might endorse that violation. This is why consequentialism on its own can come into conflict with respect for autonomy. Another challenge is measurement. Outcomes in healthcare are complex and not always predictable. How do we measure well-being? Is it survival, quality of life, patient satisfaction, years lived, or cost efficiency? Different answers lead to different ethical conclusions, even within a consequentialist framework. There's also the problem of distributive justice. A policy that improves average outcomes may still disproportionately harm vulnerable populations. Consequentialist reasoning must therefore be carefully balanced with fairness, equity, and attention to social determinants of health, concerns emphasized throughout healthcare ethics. Because of these limitations, consequentialism is rarely used alone in clinical ethics. Instead, it is often integrated into broader decision-making frameworks, particularly principlism, where outcomes are considered alongside autonomy, justice, and professional duties. In practice, healthcare professionals routinely use consequentialist reasoning when evaluating treatment options, designing policies, allocating resources, and responding to public health crises. The ethical challenge is not whether to consider consequences, but how much weight to give them, and what limits should be placed on outcome based reasoning. Consequentialism reminds us that healthcare decisions have ripple effects beyond individual cases. It pushes clinicians and policymakers to think systemically, responsibly, and with awareness of real world impact. At the same time, healthcare ethics insists that outcomes must never be pursued at the expense of human dignity, trust, or moral integrity. Understanding consequentialism is therefore essential, not because it provides all the answers, but because it explains why outcomes matter so deeply in healthcare, and why ethical decision making must always balance results with principles, character, and respect for persons. Or